So when and where is a labor induction necessary during pregnancy?
That's a whole chapter textbook, but I'll break it up generically into a few areas. One is maternal reasons. They're for the mom, we need to do it. Fetal reasons because of the baby, because we're worried about the baby. And then the other reason might just be sort of social or logistic reasons. So I think when there's a clear medical reason, that's usually very clear. There are certain medical reasons that we definitely have to do an induction. I think some common examples would be like preeclampsia, where the mother's blood pressure can go up high in pregnancy, and the mom can, in rare cases, have seizures and stroke, but also affects the baby and baby's growth and oxygen perfusion through the placenta at some point. So those are common ones. And I say the common one that I think patients have some resistance to, which I understand why, is that the baby's just measuring kind of big. And so our practice is that we usually do an ultrasound at 36 weeks. That's the last time you can kind of do it where the ultrasound's not wildly off on the measurement, because it gets worse and worse in accuracy the further you go along. And if the baby's measuring large, like 90th percentile, we'd recommend induction generally at 39 weeks, because there's these really rare cases of what's called shoulder dystocia where the baby gets stuck, and also just increases the risk of C-section if you keep going. So I think some people understandably want to go naturally, but any OBGYN, which is most people who've been practicing for a while, if you've been practicing only a few years, you may not have experienced it too much, but all of us have experienced where the baby gets stuck, and it's very unpredictable. It can even be in a smaller babies, but certainly if it's a bigger baby, there's a little bit more chance of that happening. And there's only so many maneuvers that we can do to get the baby out once the head comes out. If the baby never she's pushing for 4 hours and the baby just doesn't come out, that's an easy decision. That's a C-section. There's not much more to do. The scarier thing, which people don't realize, is the baby's kind of inching through, the labor's taking forever, and pushing's taking for a long time, but no one wants to quit because she's complete and completely dilated pushing, and then the baby's head comes out great, but the whole rest of the body is stuck. And like I said, there's only so many maneuvers we can do, and I don't even like talking about what some of those maneuvers are, and because it kind of will shock someone, but they're safe. But in that process of doing some of those maneuvers, the baby can have some injury in rare cases, brachial plexus injury, where you get some nerve damage along the arm. The baby can have, some degree of hypoxia sometimes in that process. And then if you still can't get the baby out, there's really not a lot of maneuvers. We can't do a C-section at that point. And there's not a lot else we could. There are, but they're so extreme. And like any of us that have had to do those extreme measures, I've lost many years of my life having to do some of those maneuvers, and we just don't like that. We don't like being put in that position. So I totally understand from the mom's standpoint, it just doesn't fit with what her idea, what the process was going to be. But, most, women they're only going to have 1 or 2 deliveries, maybe 3 that they experience. And so, but, I've done 7,000. And so you just start seeing things, and I just don't know who it's going to be. And when bad things happen, it's very difficult at that point. I said you can't do C-section. There is this one rare maneuver, which I've never done, called the Zavanelli, where you push the baby all the way back up to try to do a C-section. But I think even Zavanelli just said you shouldn't be doing that particular maneuver, because it's just the outcomes are really bad at that point. So, and it's hard to talk about because I don't want to scare patients.
Right.
But I always say that one of the reasons why it's rare is because we induce everyone at 39 weeks that have a big baby too.
Right.